Welcome to another installment of the educational video series presented by Julie Staggers Orthodontics. This video is going to talk about some of the more common problems of the front teeth. Most people tend to notice problems with the front teeth more so than the back teeth, and these are the problems they tend to bring up with the orthodontist in their consultation appointment. The amount of crookedness of the teeth is referred to as crowding. And from an orthodontic standpoint, how crowded you are is going to determine the type and the length of your orthodontic treatment. For patients who have a mild amount of crowding like here, they tend to require less amount of treatments than people who have kind of a more moderate amount of crowding like this. And people who have severe crowding like this tend to need more treatment and tend to have longer treatment times. In addition to crowding, another common problem that people notice about front teeth is the overlap of the front teeth. And there are two terms that are used to describe the overlap of the front teeth. The first term is overjet. And this is the horizontal overlap of the front teeth. A frequent mistake is to refer to too much overjet as having an overbite or buck teeth. An overbite is actually having too much vertical overlap of the front teeth. When you look at front teeth, you should be able to see some of the bottom teeth as well as the top teeth. Too much overjet and too much overbite are two problems that will require orthodontic treatment to correct. Another common problem with the front teeth are crossbites. A crossbite occurs when you have the upper teeth inside of the lower teeth, like you see here. Normally, the upper teeth should be totally on the outside of the lower teeth, like you see here. A crossbite may involve multiple teeth, or it may involve just one tooth. The more teeth that are involved in the crossbite, the more orthodontic treatment is needed to correct it. A gap between the upper central incisors, which are the two front teeth, is a very noticeable problem. How much of a problem depends on what age you are and how big the gap is. It is normal for children during the transition from the baby teeth to the permanent teeth to have a gap between their central incisors. As the upper canines come in at around age 12, this gap tends to get smaller or totally go away. If you have all your permanent teeth erupted and you still have a gap, this is a problem that typically requires orthodontic treatment to correct. Missing teeth is another type of front tooth problem. In theory, any front tooth could be missing, but most commonly the missing teeth that are seen are the upper lateral incisors. Sometimes both left and right lateral incisors are missing, and sometimes just one lateral incisor is missing. This is a genetic problem. You inherit it just like you inherit the color of your hair or the color of your eyes. Whenever teeth are missing, orthodontic treatment is needed. The opposite end of the spectrum to missing teeth is having extra teeth. The most common location for extra teeth is between the upper central incisors. That's the two front teeth. But every now and then, you can have two lateral incisors either on the top or on the bottom. One of the more difficult problems to fix in the front teeth is an open bite. An open bite is insufficient vertical overlap of the front teeth. Now, this can be caused by thumb sucking or tongue thrusting, but sometimes it's a genetic problem as well. How big of a problem depends on how big the open bite is. Sometimes when you have one that's like this, is going to require more treatment and a longer treatment time than a more mild open bite problem like this. Another aspect of the front teeth that orthodontists look at is the dental midlines. The dental midlines are where the two front teeth of the top teeth and the two front teeth of the bottom teeth come together. Ideally, the midline in the top teeth should match the midline on the bottom teeth. A slight discrepancy in the dental midlines is not a major problem, but if you have a significant difference between the upper midline and the lower midline, orthodontic treatment is needed. I hope you found this video helpful in understanding your front teeth problems. Please be aware that this video is for educational purposes only and is not a substitute for an in-office consultation with an orthodontist. If you have further questions, please give us a call at Julie Staggers Orthodontics. We look forward to meeting you.